Herpes zoster involving the S1 dermatome complications. Signs and symptoms. The earliest symptoms of herpes zoster are headache, fever, and malaise. They are followed by sensations of burning pain, itching, and hyperesthesia. Skin rash is seen and later it becomes vesicular, forming small blisters filled with a serous exudate as the fever and general malaise continue. Epidemiology. Varicella zoster virus has a high level of infectivity and has a worldwide prevalence. Herpes zoster is a reactivation of latent varicella zoster virus infection. Zoster can only occur in someone who has previously had chickenpox. Herpes zoster has no relationship to season and does not occur in epidemics. There is, however, a strong relationship with increasing age. The incidence rate of herpes zoster ranges from 1.2 to 3.4 per 1,000 person-years among younger healthy individuals, increasing to 3.9 to 11.8 per 1,000 person-years among those older than 65 years, and incidence rates worldwide are similar. Etiology and diagnosis.
Hello, welcome back to Online Derm Clinic. I'm Dr. Chris Schock. Today I'm going to speak about herpes zoster, also known as shingles, a very common reactivation of the chickenpox virus. Let's talk about herpes zoster or shingles. Well, here you can see pictured an example of shingles. Well, just what is it? Well, what happens is that when we're usually children, we contract chickenpox or the varicella zoster virus. Well, this virus lives with us for our lifetime once we have it. It lives in a region of the nerve called the dorsal root ganglion. Well, reactivation of the chickenpox virus causes shingles. Why does it happen? Well, again, the virus lives with us for the rest of our lives. Well, a decrease in cell-mediated immunity leads to reactivation of the VZV virus. It travels along the sensory nerves, so the nerve that gives sensation. It starts along the spinal column, and then it travels along this nerve, causing pain and nerve damage as it travels along that nerve, and eventually makes it to the skin and causes a rash. Why does it come out? Well, most commonly it's because of aging. As we get older, we become at increased risk due to the natural senescence, the natural aging of our immune system. We become at increased risk for reactivation of this virus. If you are on immunosuppressive drugs, let's say you're an organ transplant patient, or you have a chronic inflammatory skin disease, or any type of chronic inflammatory disease requiring immunosuppression, you're at increased risk for shingles or herpes zoster. Well, how does it present? Well, often people have a flu-like illness for several days or even a few weeks prior to breaking out in the rash. Usually they'll get dermatomal pain. That means pain in the region that sensory nerve controls. So a sensory nerve will control the sensation for one side or one region, a circumscribed region of the body. Well, usually there's pain but no rash for the first 2 or 3 days. Later, it erupts as a hive-like rash, and eventually it can progress to blisters. Sometimes they're hemorrhagic or bloody blisters. It's important to note that it's in one region and it does not cross the midline of the body. Eventually, again, blisters evolve, and it's quite painful in most cases. There are a few subtypes or regions where herpes zoster can be a little more dangerous. Herpes zoster oticus. Well, this is shingles or zoster of the face and in particular the ear. The reason this is so important is because it involves the V3 branch of the trigeminal nerve that controls sensation for a region of the face along the jawline and ear, and it can also get into a nerve called the facial nerve, which controls movement for the face. So when zoster oticus evolves, one, it can lead to deafness. Two, it can lead to a one-sided facial paralysis. So it's very important that we identify zoster in this region and treat it early because we can decrease the chance of facial paralysis and deafness by early therapy. Another region that zoster can be important to treat early is herpes zoster ophthalmicus. What that means is that you have zoster that involves your eye. Well, here you have pictured Hutchinson's sign. Well, if you have blisters on your pane first, then blisters evolving on your forehead, around your eye, and in particular your nose, that is an indication that you have involvement of the V1 distribution of the trigeminal nerve. Anyways, the nerve that controls this region of our face, and it can get into the nerves around the eye and cause blistering, and it can cause blindness. So again, early detection of herpes zoster ophthalmicus is very important. Other regions that zoster can occur is across the left side of the chest. It can be thought to be a heart attack in those cases where people are having pain across the left aspect of their chest, and then later the rash develops. Or again, post-herpetic neuralgia is another complication of herpes zoster. What that means is that you have pain in the region lasting greater than 6 weeks. So the longer and more severe your rash is present without therapy, the greater your risk tends to be to have persistent pain in the area. Also, the older you are, the more likely that you'll have some persistent pain. So you can imagine that as this virus travels along the nerve, causing nerve damage, that can lead to very prolonged pain. Nerves don't repair themselves very well, and so sometimes post-herpetic neuralgia can last for months or even years in some cases. Fortunately, there are some therapeutic options, and you can access those options on our website or watch our post-herpetic neuralgia video. Well, I hope you found this tutorial about zoster helpful. As always, thank you for allowing us to participate in your care.
Complications: postherpetic neuralgia, secondary bacterial infection, motor involvement including weakness, especially in motor herpes zoster. Eye involvement should be treated early and aggressively as it may lead to blindness and Ramsay-Hunt syndrome. Pathophysiology.
Post-herpetic neuralgia, in contrast to diabetic neuropathy, most commonly manifests as mononeuropathy, meaning the condition affects a single nerve root. The herpes zoster virus causes chickenpox, but also remains dormant in the body's dorsal root ganglion cells once chickenpox has subsided. The herpes zoster virus can reactivate at some later point, causing shingles. Why the herpes zoster virus reactivates in a specific person is rarely understood. However, known causes include immune system depression and other CNS conditions, including stress, hormonal changes, or or nerve injury. When herpes zoster reactivates, it inflames dorsal root ganglion and infiltrates dorsal root neurons. This inflammation hinders dorsal horn cellular metabolism. In particular, it impairs nerve conduction and pain transmission. The herpes zoster also targets the peripheral segment of the dorsal root ganglion. The virus travels from the dorsal root ganglion to peripheral nerves, causing shingles' characteristic rash. Once in the peripheral nerves, herpes zoster can cause peripheral demyelination and fibrosis.
Treatment.
Hello, and welcome to Online Derm Clinic. I'm Dr. Chris Schock. In this tutorial, we'll talk about therapeutic options for the very common reactivation of chickenpox, known as herpes zoster, also known as shingles. So let's delve into the therapeutic options for herpes zoster. Again, it's also known as shingles. It presents as a localized
Prognosis. The rash and pain usually subside within 3 or 5 weeks, but about 1 in 5 patients develop a painful condition called postherpetic neuralgia, which is often difficult to manage. In some patients, herpes zoster can reactivate, presenting as zoster-seen herpes, pain radiating along the path of a single spinal nerve, a dermatomal distribution, but without an accompanying rash. Thank you.